Small, independent primary care practices face hurdles when switching from paper to electronic health records. The process of inputting data, scanning documents, and upfront costs for EHRs can be time-consuming and expensive. The practice staff at Geauga Family Physicians face these challenges and emerge with a workflow that works smoothly and efficiently.
We were really pioneers, and we were so excited that Quest and LabCorp came right on board with us and interfaced with the labs, and that was very helpful. Then after that, one of the smallest hospital system in the area was the first interface with us with labs and radiology. And then a year, maybe 2 years later, another hospital system did. But the largest hospital system, the one that I think would have the most resources, has yet to interface with us.
One of the biggest benefits, the staff says, is there's no more searching all over the office through piles of charts to find the one you're looking for. Also, the 3 doctors at the practice know better what the others have done in terms of treatment because they can immediately read the electronic records. This is especially helpful over weekends when they cover for one another.
Big thing with EMR is the fact that we're not running around the office looking for a paper chart. A phone call comes in, and we used to have to, back in the day, look for that chart to attach that phone message. Well, that chart might be in a lab pile. It might be in the radiology pile for one of the doctors to look at. So we had literally like 6 places to look for charts. Not counting the place where it really ought to be on the shelf, but some of the patients, the chronic patients, they were never at their home on the file cabinet. They were always out about the office, which meant we had a girl that's all she did all day, was take the phone messages from a bin and go and find the charts. And we don't have that anymore. There's no running around looking for charts anymore. That by itself is a huge help. Your message is attached right to that patient's electronic record for me to look at in a moment, the doctor to look at in a moment, the nurse to review. It's right there. So
Also, we found that it was really great for the doctors to know what the other was thinking, and so in cross coverage. So that was a big help.
Coding and billing for primary care doctors can be difficult because they see patients with several chronic conditions at the same time, sending them to specialists for one condition only when necessary. The use of electronic health records makes that confusing coding more accurate today than ever before.
the doctors are assured that even though that in their mind they know that they've spent a lot of time on a patient, this patient's in with 3 and 4 huge problematic diagnoses, and they really always felt in their good conscience, oh gosh, do I bill a 215? Do I not? Oh, I better not. So they'll downcode themselves. EMR has allowed them that assurance that when they've put in all this data and that pops up that it's okay for a 215. We're seeing the 215s in the billing department.
214.
And, 214s, we've kind of always seen those, but those were the big ones. Where I know with the complicated patients that these docs see, 215s were few and far between, and now I'm seeing a few more of those. When we had handwritten route slips, the doctors we had many codes that they could mark with a box, but oftentimes in family practice, you're seeing everything. There are diagnosis codes too numerable to get on a route slip, so they'd write it out, chicken scratch it, and a little quickly, they knew what they were thinking. Well, we get to billing, it's like, what is that number? Well, we can't guess at that, so it was running back and forth, sticking it back on the patient's chart. What number do you really want on here before we could do the billing? So that has really been wonderful that we don't have to double guess what those numbers are. And with all the electronic billing helping us in regards to our med management system, the coding is always the most up-to-date as far as diagnosis codes go. All the decimal, the 5 and 6 digits, it's always correct and to the best that we can send out of here.
Thanks to Geauga Family Physicians for helping us understand the changes in workflow for staff. If you'd like to learn more about electronic health records and our statewide health information exchange, go to www.clinisync.org.